Why are some drugs given as tablets, some as injection, and some simply applied on the skin? The answer lies in the roots of the drug administration. Now, interestingly, most drugs can actually be given through more than one route. So, the real question is, how do we decide which route to use? The choice depends on both the drug and the patient. In real clinical practice, things like feasibility, convenience, and common sense often guide this decision. For example, if we look at the physical and chemical properties of the drug, whether it is solid, liquid, or gas, and also its solubility, stability, pH, and irritancy. Another important point is the site of desired action. Sometimes we want the drug to act locally at a particular site, and sometimes we want a generalized systemic circulation and effect. We also think about the rate and the extent of the absorption, the effect of the digestive juices, first pass metabolism, how rapidly the response is needed, whether it is a routine treatment or an emergency. The accuracy of dose required, where intravenous and inhalational routes allow fine tuning. And even the condition of the patients. For example, if the patient is unconscious or vomiting. So, based on all these considerations, routes of drug administration are broadly divided into two categories: routes for local action and routes for systemic action. Today, we'll focus on local routes of the drug administration. Local routes are used when the drug needs to act as a specific accessible site in the body. In these cases, systemic absorption is minimal or sometimes absent. So, the drug stays concentrated at the target site while systemic side effects and toxicity remain minimal. The most common example is topical application, which simply means applying the drug directly to the surface for a localized action. On the skin, drugs may be applied as ointments, creams, lotions, paste, powder, dressing, or sprays. Now, if we talk about mucous membranes, the dosage form depends on the site. In the mouth and pharynx, drugs may be used as paints, lozenges, mouthwashes, or gargles. For the eye, ear, and nose, they are commonly given as drops, ointments, irrigation solutions, or nasal sprays. In the gastrointestinal tract, some non-absorbable drugs are given orally to act locally. For example, magnesium hydroxide and neomycin. For the bronchi and lungs, drugs can be given as inhalations, aerosols, nebulized solution, or fine powders such as salbutamol. There are also other local applications. In the urethra, drugs may be given as jellies like lidocaine or as irrigation solutions. For vagina, we use dosage forms as pessaries, vaginal tablets, inserts, creams, powders, and douche. In the anal canal, drugs are used as ointments or suppositories. Some deep tissues can also be approached locally using a syringe and needle, provided systemic absorption remains slow. For example, an intra-articular injection means giving the drug directly into a joint cavity, such as hydrocortisone acetate. An intrathecal injection means administration into the subarachnoid space containing cerebrospinal fluid around the spinal cord for the drugs like lignocaine and amphotericin B. And retrobulbar injection refers to the injection into the space behind the eyeball. Again, the drugs like hydrocortisone acetate. There is also close intra-arterial injection, which is used for contrast media in angiography. Sometimes anti-cancer drugs are infused through arteries like the femoral or brachial artery for the localized treatment into the limb malignancies. The next video will move on to the systemic routes of the drug administration. For today, that's all. Thank you for listening.